it is with great pleasure that I get to introduce Dr. Barbara Sargent today. She is an associate professor in physical therapy here, and she's been here for 8 years, has been doing some phenomenal work in pediatrics, both understanding mechanism that she'll talk about, and then leveraging that into developing interventions that really help these children, or I should say infants predominantly, but aren't they children as well? Her research lab is development of Infant Motor Performance Laboratory, otherwise known as the DIMPLE Lab. And recently, excitingly, she's just received some funding from the American Academy for Cerebral Palsy and Development Medicine, and also funded from the NIH through the National Pediatric Rehabilitation Research Center, also known as C-Progress. And so, Barbara, please.
Again, I'm Barbara. I'm the director of the Development Infant Motor Performance Laboratory, and my research really focuses on the early identification and intervention of infants at high risk of cerebral palsy. And specifically, what I'm interested in is this impairment in selective motor control. So when infants are first born, they tend to move their legs kind of in patterns of the hip and knee and ankle kind of flex together and then extend together. But over the first 6 months of life, selective motor control emerges so that they can move just their hip or just their knee without moving the other joints. And so what I'd like to know is, can we use this to identify infants at high risk of, or infants who will develop cerebral palsy really early, because these children, they never develop this more selective motor control. And then also, are there ways that we can develop interventions to help these infants, again, really early at 3 to 4 months, when this selective motor control is first emerging in the typically developing infants, to actually demonstrate more selective motor control later on. And then I'd like to tell you a little bit of our clinical trials work and knowledge translation work. So one of the projects going on to the lab is the identification of infants at high risk of cerebral palsy. And we're following children from 1 month to 9 months of age, both typically developing children and then children at high risk of cerebral palsy, and seeing if we see this difference in selective motor control during spontaneous kicking, during foot reaching, and taking steps on a treadmill. And spoiler alert, we are starting to see those differences, so it's really exciting. I'm also working with Dr. Eileen Fowler on developing the mini scale so that clinicians can assess this clinically and document change over time. We've also been developing this infant kicking activated mobile task, whereas if infants kick in a certain way, they can make this mobile move and play music. So trying to determine, can the children learn that it's their leg actions that are causing this mobile movement? And then also, does more selective motor control emerge as they kind of play with the mobile? And then since Dr. Stacy Dusing started on faculty, I've been working with her on some randomized clinical trials. So we have one together on the NICU to home for infants at high risk of cerebral palsy. And then I'm also helping her with her study on a clinical trial comparing 2 types of PT intervention for infants with cerebral palsy. I'm also highly committed to knowledge translation. So I'm one of the authors on the clinical practice guideline for torticollis, which has also been translated into Spanish. And then I help the pediatric residents with systematic reviews on a yearly basis. So we have a bunch of them now. We have ones on the cross-cultural validity of motor developmental assessment tools, kids with congenital muscular torticollis, pediatric heart transplantation, autism, and leukemia. We also have one that was just accepted for the effective intervention for infants at high risk of cerebral palsy, and another in review for adults with cerebral palsy. So thank you.